think I'm having an anaphylactic reaction.
OK, I'm getting help arranged for you now.
Please help me. I think fucking so I'm going to die.
Just stay on the line and I'll tell you exactly what to do next, OK?
Support 215 and TM 1541 received details, thanks, in Keysborough.
Single responder Mark has just been called to what could be one of the most serious cases of the day.
OK, I'll stay on the line until help arrives there.
A 41-year-old woman, home alone, is calling in the middle of a massive anaphylactic reaction, the cause of which is currently unknown.
Hello, are you there? Hello? What's happening? Ma'am, are you there?
The woman is losing consciousness and needs urgent intervention.
She's apparently ineffectively breathing. The main concern for me would be that she's got airway swelling, which is obviously immediately life-threatening for her.
Because the case is so serious, several responders are sent to help.
G'day, struggling to get in?
Door's locked.
Oh, is she? As I arrive on scene, there's already another paramedic there who informs me that the house is in lockdown and no one's answering his calls. I take one look through the living room window and I can see the patient slumped unresponsive on the couch.
Break the window? No.
Nah, it's a board. Can you answer me?
There is no time to lose. The team quickly loosens a section of window frame. But the window itself will not budge.
This really is a case where seconds count between life and death. We really need to get in there ASAP, otherwise she's going to die.
Window.
We're going to have to break it.
We're on our way to an 86-year-old female with sudden pain in chest, with a history of stents and a history of angina.
In Melbourne's northeast, paramedics Nicola and Risky are on their way to a patient with worrying cardiac symptoms.
Now you're clear.
With a pre-existing heart condition of angina, she's already had stents fitted in her blood vessels to keep them from blocking up.
Oh, this could be it.
So whenever we're dispatched to a patient with chest pain and they've got a history of angina or stents, I immediately think, uh-oh, this could actually be the real deal. This could actually be a heart attack.
Just here. Hello.
Absolutely.
Who are we here to see?
Your wife.
Your wife. Hello.
On arrival, the team finds 86-year-old Elsa seemingly up and well and being looked after by husband Keith.
Do you want to have a seat, Elsa?
Good. Yeah.
So, Elsa, what's happening this morning?
Well, I just missing myself heading off to start doing some cooking.
Yeah.
And I was perfectly all right. And it was just as if all of a sudden I'd walked into a brick wall.
Okay. How would you describe it?
Somebody punched you.
Like someone's punched you.
So we walk in and we see Elsa and she's remarkably calm for somebody who could potentially be having a heart attack. However, in my experience, that doesn't mean that there's not something serious going on still.
And these symptoms, Elsa, this is exactly what you felt like when you had your stents last time?
Yes.
Yeah. Do you have any shortness of breath?
Yes.
The fact that Elsa's had stents in the past makes me think there's no reason why there isn't another blockage. The way that Elsa's describing her chest pain, along with the fact that she's saying she's short of breath, is definitely typical of heart attack.
Nicola and Risky urgently need to assess Elsa's heart using an electrocardiogram, or ECG.
Are you feeling a bit anxious, or is it the pain that's worrying you?
I get anxious about having to call the ambulance.
Yeah.
I don't want to do it.
Yeah. Because you're worried about us, or don't worry about us. This is what we're here for.
When Elsa is apologetic for calling us, I just think With my experience, it's always the people that hesitate to call us or think that they're bothering us are the people that should be calling us. She could be having a heart attack, and every minute that goes by that the heart is starved of oxygen could be causing irreversible damage. Just sit nice and still. We're just going to take a picture of your heart now, okay?
A woman has lost consciousness and collapsed after a life-threatening allergic reaction. Mark and a team of paramedics are having trouble breaking into her house.
Can you answer me?
Their patient could be just minutes away from death.
We really need to get inside ASAP, and the most obvious solution is to break the living room window. But there are risks associated with that, so we start looking at some other options.
Just use these.
I noticed that there's a plank of wood keeping the living room window ajar. Then there's actually a garden utensil which I can use to gain us access.
Am I in the right spot?
You just hit in the frame, that's it. Can you drop the point down lower? Yep.
This is a really stressful situation. I've got a critically unwell patient who's only metres away and I just cannot get access to her.
Now just get her back on it again. One more time. Just as much as you can. Right, we're in. Look at jumps a bit here. Not be bad.
Open your eyes for me. Yeah, we'll need everyone in.
It's a really eerie experience as a paramedic. Seeing that a patient has actually become unconscious whilst on the phone just shows how sick she is and how quickly her condition is deteriorating.
Yeah, she's profusely diaphoretic and cold.
The anaphylaxis is weakening the patient's circulation, causing a critical drop in blood pressure. Mark urgently needs to get blood flowing back to her brain.
I'm going to relocate her onto the couch here and get her legs elevated in supine. All right?
Yeah.
Ready, set, go. Let's get a manual blood pressure, guys, because I think that's going to dictate where we're going. OK, can I get another couple of pillows, guys?
The patient's skin really tells the story of how critically unwell she is. She's red, which is common in anaphylaxis, but she's also that horrible grey, pale colour. She's really sweaty and I can't actually feel a radial pulse. So I know that her blood pressure is extremely low.
How you going? What's your name, darling? What's your name?
Shauna.
Shauna. Mark is my name from the ambulance.
Yeah.
Let's prep some adrenaline. OK, shots out, guys. Thanks. Bit of a sting in your leg, sweetie.
Mark gives Shauna adrenaline, which helps restore circulation and return blood pressure to normal.
Can someone note the time of the adrenaline, please?
50.
But after one dose, Shauna is still critically unwell.
We might just start to work towards drawing up an infusion because she's probably going to need it.
So I'm just going to pump up that blood pressure.
Paramedics Nicola and Risky are with 86-year-old Elsa, who is showing the worrying signs of a heart attack.
Just sit nice and still. We're just going to take a picture of your heart now, okay?
Husband Keith knows with her history of angina and stents, there's a high chance Elsa could be having a serious cardiac event.
He's standing there and he's pretty quiet. I don't think he actually knows what to do in this situation. The poor guy, I mean, it's pretty hard watching your wife maybe have a heart attack.
Elsa's situation is precarious, but she has other things on her mind.
I've got cards today and I've got to put my rings to go to cards. I was all set, ready to go with my rings.
Oh,
Thank God
it's always the
before
way.
it's halfway through.
I know. All right.
so the picture that we've got of your heart at the moment isn't showing us anything unusual, but the symptoms you're describing sound heart-related.
The ECG has ruled out a major cardiac event, but the team can't discount a milder heart attack until Elsa is tested at hospital.
What I'm going to give you now is 2 tiny little tablets that sit under your tongue. You've had those before, I imagine. So pop that one under your tongue. How's that feeling in your chest going, Elsa?
I'm thinking what I should be doing. I'm thinking
Has so much
I'm the
planned.
one who's got to take the cheeses and the
Oh,
and
no.
the-
Oh, no.
today, so I'll have to ring up and say,
They're going to go without cheese. That'll be a disastrous card game.
Elsa's clearly a very strong, stoic woman. I think she's the kind of woman that would put everyone else before herself. Prime example right here, she's potentially having a heart attack and her main concern is the cheese and the meringues going to the ladies at the card game.
Let's get you sorted.
Okay, next dose of adrenaline, guys. Are we due?
Yes.
Sharp's out.
Mark and the team are still desperately working to stabilise patient Shauna's blood pressure after a massive anaphylactic reaction.
Yeah, I'm having trouble recording one, so it's obviously still very low.
To support her breathing, they apply a Ventolin-infused mask and give more adrenaline to boost her circulation.
Shauna, you've had a really nasty anaphylactic reaction. You're right, we'll look after you now. You'll be okay. Yeah, it does. For some people, it happens very, very, very quickly, all right? I brought an infusion bag in, mate, if you want to try up an infusion.
A case of anaphylaxis as serious as Shauna's requires a continuous dose of adrenaline via an infusion. So we set that up and connect that to the drip before we get her loaded to the stretcher.
1, 2, 3, up.
With her blood pressure now back in the safe range, the adrenaline infusion will help keep Shauna stable if the anaphylaxis recurs.
She's by no means out of the woods yet. Her body is really reliant on the continuous dose of adrenaline via the infusion. She really can't afford to deteriorate any further.
You ever had an anaphylactic reaction?
Not like this.
Have you had one in the past?
Maybe penicillin.
Yeah.
As Shauna reveals a history of anaphylaxis,
We took the test like 15 minutes prior to falling.
Sure.
it becomes clear a simple antibiotic has triggered her reaction today.
Within 15 minutes of taking that medication, she started to notice that things weren't going well. Shauna's call at that exact moment has probably saved her life.
But Shauna is not out of danger yet.
How are you feeling? You lightheaded or dizzy?
I don't know.
Mark has noticed something is terribly wrong.
So I reassessed Shauna's condition and I realised that her blood pressure's fallen dramatically again.
Sorry, mate, I couldn't get a blood pressure, so I've gone to 10 mics a minute.
Yeah, absolutely.
So what we need to do is to escalate the dose of the adrenaline infusion that we're delivering. And I decide that it's important that another mica paramedic, Pete, travels with me to hospital just in case her condition worsens.
Good afternoon, Dandenong. This is Support 215 along with Micro Response 7. We've got a notification for an anaphylaxis patient for you. It's a 41-year-old female. Her anaphylactic symptoms have improved somewhat but are persisting.
We're about to arrive.
Thank you.
Shauna is critically unwell. She's one of the worst cases of anaphylaxis I've ever seen.
Alrighty.
Cases like this really make me realise how fragile life is, and I'm really not sure how things are going to end.
So we're going to get going up to the Epworth. So if you can organise Keith to ring and let them know that Elsa won't be coming to the cards.
Yeah, I'll do that.
Risky and Nicola are about to head off to hospital with 86-year-old Elsa, who, despite some worrying cardiac symptoms, has so far been more concerned about catering for her weekly card game.
They'll have to eat something else today. That's the important message we need to get through.
just biscuits.
There's no cheese and meringue. Not today. Elsa seems to be more concerned about everybody else, but I think given the circumstances today, she should probably put herself first.
just hate going in to false alarm.
Well, I wouldn't take you if it was a false alarm because you've got a history of heart issues.
I don't know. I always want to be the one who's able to cope and
Yeah, and I can understand that, but it doesn't matter how good you are at being able to cope. If you're having a heart attack, we want to make sure it's not something serious. On the way to hospital, I'm trying to get Elsa to understand that this is the type of thing she should be calling an ambulance for. And my concern is that in the future, if this was to happen again, she'd still hesitate to call. Going out to people like yourself who are suffering from chest pain, that is what the ambulance is for. So don't feel like it's, oh, we should be doing something else. Like, this is what we should be doing, okay? So you're not wasting our time and you're not doing the wrong thing by calling. That's what we want people to do, okay? Agreed?
Yes, I promise.
All right, I'll remember that. It's on camera. When I'm Elsa's age, I'd love to be having a weekly card game and just hanging out with my friends, eating nice food. But this is a case where she's got chest pain, she needs to call. We'd rather come out, assess you and tell you that there's nothing going on than have to tell you you're in big trouble when you should have called earlier.
Elsa will now undergo tests to find out if her heart needs further intervention or stents. It's a quiet start to the next day's late shift, and Mike and Jamie are discussing plans for their futures.
You having kids anytime soon? No, mate. No. What about you? You're in a serious relationship. Are you having kids anytime soon?
We'll move into the house first and we'll go.
Oh, but it's on the cards. You want to have kids?
Oh, yeah. I'll definitely have kids.
I think definitely see marriage and children in the future. I absolutely love kids. I get along with them really well, partly because I'm a big kid myself.
Kids are easy. They're so much fun.
Ideally, how many kids?
Probably 2 or 3.
Nice, yeah. Little clan. I think 3 is good because then you don't need a big car.
No, and then 4 you're getting a bit too much. And,
I know, right?
Emergency services. My son has been waiting since Friday.
Are you with him now?
Yes.
How old is he?
He's 16 months.
As luck would have it, the job Mike and Jamie are off to next is a child in need of help.
Is he breathing?
He's like breathing very quickly.
All right, mate. We are off to a 16-month-old male who apparently is short of breath and wheezing.
Yep.
They've been wheezing for 3 days, and apparently it's worse today.
Pediatrics are always the worst. Anytime we get dispatched to kids with breathing difficulties, we are quite worried because they can be quite fragile and change very quickly.
Okay. I'd say that's probably our patient.
That'll be the one. Hello. How you going? My name's Jamie. I've got Mike with me. Is this that little guy that we're here to see?
Yes, yeah.
What's his name?
His name is Pars. My name is Poonam.
1-year-old Pars has been in and out of hospital for the past 3 days and is already being medicated for a nasty case of croup.
We went to hospital on Friday. They gave him dexamethasone 2 ml. So he did not improve at all.
Yeah, right.
Croups are a very common viral illness that affects children. It makes their whole upper airway swell up. They often get this barking cough that most parents will know. Usually they get better after a week or 2, but sometimes they can be really sick.
So what's happened this afternoon?
So he had a little nap. When he wake up from his little nap, he was like breathing problems.
Yeah. Okay, so just struggling to breathe,
Yes,
wheezing
yeah.
and stuff. Yeah, okay.
Really.
I'll very quickly pop this in his ear if you can hold him still. Oh, sorry, Bubba. Great. 38.9, so he's a bit warm.
After our assessment, we haven't really found anything sinister going on, but Paz has obviously been dealing with croup for the last couple of days, so he definitely needs to come up to hospital and get seen by a doctor.
All right, whenever you're ready, we'll start heading off, all right?
Sure.
It's a precautionary visit, but it's Pars' 3rd trip to hospital in as many days.
So we'll pop him on the bed there.
And he's not happy about it.
Oh, you're okay. Poor little thing.
It really breaks your heart to see a toddler so distressed, but I'm going to try my best to make sure he's comfortable.
It's a nasty cough.
Emergency services, tell me exactly what happened.
My mother's fallen over. She's just lost her footing. She's on the floor and she's in a lot of pain.
Look, I'm organising help for you now.
Across town, Amanda and Taz are on their way to a patient in the northern suburbs.
85-year-old female?
Yep.
Fell on ground. Pain in hip.
Oh, poor
Nana
thing.
down, Nana down.
Nana down.
As an elderly person who's fallen, it's a common case. Paramedics attend hundreds of Nana Downs every week.
Good evening. I'm Tess, and I've got Amanda. All right, after you.
Cecilia's on the floor, Taz.
Cecilia.
Yeah.
Okay.
On arrival, they find a terrified 85-year-old Cecilia still lying where she fell on hard floor tiles.
Good evening, Cecilia. I'm Taz, and that's Amanda.
What have you done?
Now complaining of hip pain, Cecilia's family members have been reluctant to move her.
I watched her sort of in slow motion. She took the brunt on her hip, her shoulder, and then her head. My brother and I went to assist her and she said, "Don't move me, call an ambulance."
Have you got any pain at the moment?
It is because it's off. There's pressure on the bone.
Pressure on the bone. Do you think you can stretch this leg?
I'm terrified, isn't it?
Slowly.
Give me a hand just to hold it.
Yep, it is.
Relax your leg. Just relax your leg. Relax your leg. Good.
Your hip's going to be fine.
Good.
I'm telling you.
Good.
Family were concerned about Cecilia's hip pain, but we were looking at the overall picture.
Is it pain there?
With elderly, the impact from the hard concrete or the tiled ground can have a lot more damage than you can expect.
Cecilia, I need to really know, is this hurting where I'm pressing my hand? It's tender there?
Tender.
Okay, all right. Now, I want you not to move your head at all.
Cecilia reveals to us that she's also experiencing some neck pain, so there could be some type of spinal issue going on here too.
She must have hit her head hip. She hasn't moved, basically. Yeah.
While they won't know the full extent of Cecilia's injuries until she's x-rayed at hospital, the chances are high she has fractured her bones.
It's really tough for women in particular, over about the age of 75. They don't repair the way younger women do. So having a minor fracture, let alone a major fracture, could actually be life-threatening. Just relax, keep that breathing nice and slow for me, okay? You're doing a really good job. You're doing really, really, really well.
What we'll do, I think we'll swap back over and I'll just keep an eye on him, okay? That's all. I think he's...
1-year-old Paz is about to make a precautionary trip to hospital for his croup.
I'll give the sippy cup back to him.
Here you go. Hey.
Since getting into the ambulance, not even Mum has been able to settle the unhappy toddler.
You're okay.
But Jamie thinks he's got what it takes.
Let's see, we've got some bubbles. Here, give that a go. They smell like oranges. Look at this.
Oh, I absolutely love kids. They're quite easy to sort of entertain. And to be honest, I consider myself a bit of a child whisperer.
Oh, it's not even working. Yeah, it's quite hard, hey? I think your bubbles aren't working at all. Well, maybe it's the operator.
Jamie likes to think he's a bit of a baby whisperer, but in all the time we work together, I don't see any evidence of that. He means really well, but, you know, he doesn't bring his own bubbles to work like some other ambos.
Moving off. You know what? You need a balloon animal. Let's get a balloon animal happening.
So there's different things that I always try and do for kids to try and cheer them up. I like to blow up a glove and draw an elephant. He had no bar of that.
Let's try the pen torch. Ready? I'm not that scary, am I? What if I do this one? Oh, poor little thing.
It was non-stop crying the whole way to hospital.
Why don't you like me?
Jamie's a very good operator, so it was funny to see him doing every trick in the book and nothing is working on him.
Is there anything that usually calms him down when he's driving? Only Mummy. He's a mummy's boy.
Fortunately for everyone, the team has now arrived at hospital where Paz will have his croup reassessed by paediatricians.
We're here now, buddy. We're here. Let's get you into Mum's arms. How does that sound? Hey? Look who it is. Look, it's Mum. Look at that.
Silence at last, but I totally get it. When you're sick, all you need is a cuddle from Mum.
Cecilia, this pain relief that I'm just about to give you, it's called fentanyl. 1 and 2. There you go.
Amanda and Taz are with 85-year-old Cecilia. They're worried she could have serious injuries after falling over on hard floor tiles.
Do you know what day is today, Cecilia?
I don't know, it's not Monday.
What month we are in? Is she usually quite dementia? Okay.
Diagnosing Cecilia is tricky. She remembers nothing about her fall.
She thinks that she's hit her face and she's complaining of some tenderness in the neck. We're just unable to ascertain whether it's new today because of the fall, so we're going to take full spinal precautions as well, okay?
Mum's very independent. She wants to be doing things, she wants to be engaged, and she perseveres. When my grandfather settled in Australia, he worked as a tailor. My grandmother assisted him with handwork, so my mother learnt to sew early in life. As a junior, she beaded for this new competition called Gown of the Year, and that gown was the winning gown.
Push.
Deep breaths, Mum. Deep breaths. She can't hold a needle very well anymore. Her hands are so gnarled with arthritis. She suffers a lot of pain. The fantasy is there in her head to create gowns, but she doesn't have the capacity anymore.
Good job. There you go, you're off the ground. Can I just get you to put your hands just across your hips like that? You're doing a fantastic job, Cecilia.
With the help of team manager Rob, Cecilia will now be taken to hospital for x-rays.
1, 2, 3. You want another? Just relax.
It's really comforting for us to see Cecilia's got a loving support network around her. It's quite evident that she's scared. I know, you've got the shakes. It's all right, my love. Try and control them for me and try and take nice deep breaths. I know it's all a little bit overwhelming, okay? But we've got you off the floor. Good job, we got you off the floor. You're very welcome. We'll have you at hospital before you know, okay? You can't help but your heart breaks a little bit. You know, old people, they're just such beautiful people and they're so vulnerable and fragile. They don't mend like young people.
So we're just going slowly.
Emergency services. What's the patient's diagnosis?
Oh, he has heart palpitations.
In the eastern suburbs, a call has come in from an unusual location.
Patient's just presented to Ringwood Private, thinking we are an emergency department.
Right, okay.
A man with a heart condition known as SVT has arrived at a private hospital not equipped to help him. Thankfully, mobile intensive care paramedics Mark and Karina are nearby and carry the drug needed to treat him.
So just up here on my left. So the job comes in as an SVT, which stands for supraventricular tachycardia. So this is the front entrance here. Yeah.
Great, thank you.
When they're having episodes of SVT, patients have an excessively high heart rate that can cause low blood pressure and a falling conscious state if not treated early enough.
Joe, my name's Karina and this is Mark.
So what do you do, mate? You work up at Chenside Shopping Centre,
In the
do you?
fruit shop, yes.
47-year-old fruiterer Joe was at work when his SVT came on, causing his heart to race out of control.
The average person's heart rate is about 60 to 70 beats a minute. It depends on what you're doing in your day. So you think you've been in it a while?
I've been in this for about half an hour now.
Okay. So this particular gentleman has a heart rate that's pretty close to 200, which is kind of like your heart running a marathon while you're standing still.
And how many times have you been treated for heart problems?
Whew. I've had it since I was 18.
Oh, wow.
For some reason, this one here feels like it's set in and it's pretty hardcore.
Yeah.
Joe's particularly relaxed about his condition because he's had it so many times before, but SVT is not something that you want to sit around with. The longer you're in it, the more damage you do to your heart, and it deteriorates into a rhythm that's not sustainable for life.
You're all right, darling.
Yep, clear.
Couple of bumps, sissy.
Paramedics Taz and Amanda are taking 85-year-old Cecilia to hospital after a fall on hard floor tiles.
Right behind you, Mother.
Mum, how could we worry when you've got all of this care around you?
You have the best paramedic looking after you.
I'm average. He's the superstar.
I don't know how your head's going to fit out of the ambulance at the end of the shift.
Since the fall, Cecilia's family has rallied round to keep her spirits up. And it's got Taz thinking about his own ageing family.
My mum and dad live in India, and so every time I go to a job like this, I think about mum and dad. It's constantly in my mind, thinking that, they're okay. And that's why I think I ring every day.
We're about a minute away, Taz.
Oh, we're already there.
It did happen a couple of times where mum was unwell and dad had a fall. So when they actually needed me, I wasn't there. I wish I could be a superhero, wish I could just fly and just go there and fix them and come back.
All right, here's Sissy.
Cecilia will now undergo tests to see if she has fractured any bones or damaged her spine. But at 85 years of age, the odds are against her making a full recovery.
Couple of bumps.
So this afternoon it came on at work. Were you doing anything in particular? No strenuous exercise? No.
Just filling up mandarins.
SVT sufferer Joe's heart is racing out of control. And having arrived at a hospital with no emergency department, Micah paramedics Mark and Karina are now in the car park trying to help.
Let's get a really good picture of this rhythm you're in now, mate. So just stay nice and still for a sec.
Yep.
Most people describe the feeling of SVT as pounding or palpitations in their chest, a thumping kind of feeling. That can be incredibly frightening. Just be a little sting in your arm here, sorry.
Joe's already tried simple exercises to bring his heart rate back down. His only hope now is a powerful drug known as adenosine.
Adenosine is an incredibly safe drug, but it has a very odd side effect of making people feel this feeling of impending doom.
When was the last time you had adenosine, Joe?
Ooh, about a year ago.
Okay. So obviously you can recall that it makes you feel a bit strange.
Correct.
What it actually does is momentarily causes the patient's heart to stop and regain normal rhythm and function. We see them take a deep breath, and we sort of take a deep breath at that time as well, knowing that those first few seconds after we've administered it can feel awful for the patient.
You already have felt it before and know how bizarre it is.
Joe is now bracing himself for the unnerving process of his heart being stopped dead in its tracks.
All All right, so here we go. You might get that yuck feeling now.
Doing well, mate. Just bear with us for a moment.
The treatment should take immediate effect. But Joe's racing heart is not slowing down.
So did you get that feeling?
Very little.
Okay. It's done very little.
And what symptoms have you got at the moment, Joe?
Just hard to breathe.
Yeah, okay.
So what we'll do is we increase the dose for the second one. So it might increase that feeling.
Yeah.
Joe must now endure a second, much greater dose of adenosine and all its uncomfortable side effects.
There's no pain involved with it. Sometimes people describe it, if they've had it before, as feeling like they're going to die.
We're right to go.
All right.
Yep.
A little bit strange, mate?
A little bit.
Bear with us, mate.
There we go.
We've just reverted
All right,
you.
so reversion is good.
Thank you so much.
That's all right, no worries.
We got there in the end.
Yeah.
The second treatment has worked. In a matter of seconds, Joe is 100% back to his normal self.
How's that feeling in your throat?
Oh, gone.
Gone?
Yeah, gone. Beautiful. Yeah. I could just get up, go back to work now.
Yep.
All right, I'll get in the driver's seat.
Sunny Maroondah it is.
Just to be on the safe side, the crew will now take Joe for a quick checkup at hospital. This time, one that's equipped to deal with his condition.
Hopefully it's brief and I'll go back to work.
Right.
Thank you so much for your help. I
That's
really
all right.
appreciate it.
Since his trip to hospital, little Paz has made a full recovery from his croup and hasn't needed any further medical interventions. But Jamie is still working on his balloon skills, just in case. As for Elsa, specialists confirmed she did have a mild heart attack, but she's now on the mend and back at her weekly card game.
Cecilia, do you think you can stretch this leg?
Oh,
It's now 6 weeks since Cecilia's fall.
Cec, you're up for a cuppa?
no more, thanks.
And after a short stay in hospital, she's been allowed back home with daughters Loretta and Jenny there to support her.
So at the hospital, she was x-rayed. Definitely a relief that there were no breaks. At that stage, we didn't understand the impact that the fall would have. She now walks with a walking frame and feels less secure on her feet. So it's really impacted. And you're happy to be home?
Absolutely.
And you're happy with the level of care at home?
Well, that's actually 200%.
Oh. These grey hairs are probably a result of her, but no. Of course, we love her dearly and we're very happy to provide the love and care that we do. So as long as my mother keeps doing the ironing, we'll do it for her. That's the deal. Is that a good deal, Sissy?
No.
Micah paramedic Mark had to break in to get to his patient. 41-year-old Shauna's anaphylaxis was so severe, she became critically ill less than 15 minutes after taking a simple antibiotic.
As soon as I took the tablets, I sort of instantly felt my body tingle. I had this impending doom rush through my body, and that's what made me call the ambulance. The next thing that I remember was wind. I could feel wind on my face, and that's where the paramedics had come through the window.
Now it's Shauna's turn to pay a visit to Mark, together with daughters Ebony and Callie.
Hey,
G'day, how you going?
Good, yourself?
Hi, Shauna. Nice to see you again.
You too.
You're looking so much better.
Thank you so much.
G'day, girls. How you going? I'm Mark.
Thank you so much.
Looked after Mum on the day. Eb and
Kelly.
Nice to meet you both. Yeah. Seeing Shauna again is really special. She's up on her feet and she looks like a completely different person than the woman I met that afternoon. So, girls, what do you think of all of this? I mean, did you come into the hospital sort of soon after? Yeah.
Like, the first thing I said is she dead?
Yeah.
You still got me.
For Mum to call an ambulance, it's something extreme. It's something where she's like, oh no, I'm in trouble and I need help now.
Well, if you guys didn't do what you did, then I would have died and my kids would have ended up finding me a couple of hours later.
Definitely glad she's still here because be a little lost.
Yeah, absolutely.
Yeah.
To be involved in a case like Shauna's is an incredibly special experience as a paramedic. Being able to treat someone like her in a life-threatening situation and to see her recover in the way she has is exactly why I joined the job.
I love my babies.
Hug from Kelly too.
Group hug.
Quick flight, it'd be like, yeah, I know, 10 minutes. 10 minute, yeah.
At the Air Ambulance headquarters, mobile intensive care paramedic Matt is on his way to the scene of a high-speed two-car crash 50 kilometres northwest of Melbourne.
There's limited information at this stage as to what's going on. What we know is that it's a country road, approximately 100 k's an hour, so the potential for a significant smash from this scene is quite a big possibility.
Roger.
Each week in Victoria, at least 10 seriously injured accident victims are flown by air ambulance crews to major trauma hospitals.
We're 1 minute out at the scene, 12 o'clock on the main road. Roger.
This time, it's taken less than 15 minutes for the chopper to get to the scene. Every moment is crucial in the bid to save a critically injured patient.
Within a metropolitan area, if you have a big car crash, within a short period of time you'll get the police, the fireys, the SES and dozens of ambulance people turning up to the scene. You put that same car accident in a country location, your resources are far less. So we need to be prepared for anything.
Yeah, I got the monitor, so we're good to go. Hey, how you going?
I'm good, how are you?
Good.
Matt's patient is 21-year-old Natalia. Her boyfriend, who was driving this blue sedan, has already been taken to hospital by another ambulance team.
Got a lot of pain at the moment?
Yes.
You have? Whereabouts mainly?
My hips, my stomach, my neck and my head.
No worries.
Get the car in.
Yeah, if we get the car in, we'll just load into the car so we can get her out of the cold and keep her warm. You're just going to put ours straight on, Don? Yeah. Thanks, mate. No worries. I'm just going to have a quick look at the car. I'll be back in a tick.
With Natalia being given pain medication, Matt goes on a fact-finding mission at the crash site.
Step around.
It's very easy to walk into a scene and become tunnel-visioned and go directly towards a patient. And if I just look at the patient and just assess them, I only get half the picture. Whereas if I walk around the scene and actually look at the vehicles and I can look where the forces have been displayed onto the car, which are also then transmitted onto the patient, it gives me more of the story as to actually what's gone on.
So not much intrusion in the cabin or anything like that. The windscreen's smashed, but that's probably going to be more due to the damage to the body of the car more than anything else.
And then when I take that back to assessing the patient and I look at them and I go, are you sore here or are you sore there? They'll probably say more than likely yes. And that's where they've received the impact.
So Natalia, we're just cutting your clothes at the moment because we need to have a proper look at you and make sure everything is okay. Where's that hurting?
But as Matt starts searching for any internal injuries, Natalia shows some other worrying signs.
So you remember the whole incident, do you?
No, I don't even know why we're here.
You've been in a car accident. There's been a big hit on the other vehicle, probably more so than your vehicle.
I just can't remember.
Maybe she's knocked her head and she has a small bleed inside her brain. So we need to gauge what's going on with Natalia as to how severe this head injury is.
At the Melbourne Emergency Communications Centre, calls are coming in every minute needing urgent help.
How's her breathing going?
I just need you to calm down, okay?
Today, a frantic mum is on the line.
Tell me exactly what happened.
found my little boy pulled a hot cup of coffee on him and his skin was all peeled off.
Okay. What part of the body was scalded?
On his face and down his arm and his chest.
Is that him screaming?
Yeah, that's him.
Oh, poor love.
215, receive K1, thanks.
Single responder Mark is being dispatched to the tiny burns victim.
It's my fault.
Just take a deep breath. It's not your fault. These accidents happen all the time. They're coming as quickly as they can, all right?
Oh, that's my spot. Thank you. Oh. This child's had hot coffee spill on their face and their chest. So the main concern I reckon out of that would be around whether the child's actually had any airway involvement, because that creates a fairly rapid onset of swelling, which can cause breathing problems and essentially the airway to close over.
The patient is only 19 months old, almost the same age as Mark's own son.
Ask any paramedic and they'll tell you that managing sick and injured children is one of the hardest parts of our role. They're helpless, they're vulnerable, and most of the time they don't exactly know what's going on. G'day.
Come in.
How you going? Mark is my name.
Hi, Mark.
Hello.
Get here.
As I walk through the front door of the house, I can hear this little boy screaming in agony. It's really tough hearing a child in such excruciating amounts of pain. My heart is beating at 1,000,000 miles an hour at how emotional and distressing the scene is.
Now, Natalia, so you remember the whole incident, do you?
No, I don't even know why we're here.
You've been in a car accident. There's been a big hit on the other vehicle, probably more so than your vehicle.
Flight paramedic Matt is assessing the 21-year-old survivor of a high-impact two-car collision 50 kilometres northwest of Melbourne.
What about everyone else? Are they okay?
Yeah, everybody else is okay. They're all gone to a hospital as well in other ambulances. Just relax.
Natalia was in the passenger seat with her boyfriend driving. She can't remember the accident.
Don't you remember me telling you that? I reckon that's the 4th time you've asked that.
Matt's now concerned his patient may have suffered a serious head injury.
So Natalia doesn't have a great recollection of what's actually occurred with the incident, which usually means to me either, it's a horrific experience that the patient really doesn't want to remember, or they've had a knock to their head which has caused them to pass out and lose consciousness.
That's sore both sides, is it?
Oh, yeah.
Natalia's also complaining about severe pain in her abdomen, potentially a sign of dangerous internal bleeding.
Now, we're just going to do a quick ultrasound of your tummy, so just relax your arms down by the side there.
The ultrasound gives us a look inside the person's abdomen, and if there is a small bleed that's going on around the kidneys or within the abdomen somewhere, we're able to recognise it with the ultrasound.
Where's that hurting? In the middle of your tummy there. No worries, okay. Now I'm going to do the same thing that I just did on that side, just on the other side for you.
With any car accident, everything inside your body is still moving, so it hits an object, but the organs inside your body are still moving, so they bash into the front of the abdomen, or they bang into the seatbelt, or they can tear off things within inside your body, which can cause internal bleeding and internal injuries.
Where's that hurting?
Oh, my hips.
Your hips? No worries, okay.
With the ultrasound, I'm looking for specific injuries around her kidneys and whether she's damaged her liver or spleen, whether she's damaged her bladder. She could have injured her pelvis, or she could have injured her hips in some way.
So there's no bleeding inside your tummy that I can see at this moment. Now I'm just going to pop this around your arm. So your tummy's very tender to touch, is it?
Yeah.
Yeah.
Especially my hips.
Your hips? Both sides?
Yeah, both sides.
Can you bend your knees up towards your chest for me? See how that goes. Yeah.
Yeah, I can.
Where's that hurting?
Yeah.
Can you just relax your legs down again for me? I'll pop the needle in her arm.
Natalia's obviously got something going on with either her lower abdomen, maybe her pelvis. She's had a bang on her head. She's got an altered conscious state because of that. So it's important for us to recognise the potential for her injuries and take her to the appropriate facility.
So we're going to take you to the Alfred Hospital. You're going to go in the helicopter on the way there.
No, thank you so much.
And your boyfriend's in excellent hands, all right? You'll be able to chat to him shortly.
Thank you.
19-month-old Jackson is in terrible pain. The toddler pulled a cup of hot coffee off the kitchen bench and has suffered severe burns.
Got 16 to 18% burns. Centre of his chest, all the way down, skin's peeling off, and down his full right arm.
Face as well?
Doesn't look like it. Looks like it's just below the jaw. I couldn't see any in his airway.
I think majority.
Yeah. There's no skin peeling off his face.
I was making a cup of coffee. I turned to go to the fridge to get the milk, and Jackson, in a split second, pulled the hot coffee on top of himself. That's how quick it happened. Seeing him there and looking at how burnt he is, it's gut-wrenching.
He's had the one set of fentanyl he's due for another set of 2 minutes.
25 mics?
25 mics iron.
Yeah.
And the active cooling is due to finish in 3 minutes.
Which would be 20 minutes, yeah.
Jackson's dad, Jason, did exactly the right thing, putting his son under the shower for a crucial 20 minutes of cold water irrigation. That should help reduce the severity of their son's burns. But now, Mark needs to warm Jackson up and dress the affected areas.
Jackson's not allergic to anything?
Not anything that I'm aware of. Come on, Bubba. It's okay. It's okay. Yep. Yep.
It may look a little strange, but in fact, the best dressing that we can apply in ambulance for burns is cling wrap. It prevents ongoing fluid and heat loss from the burn, therefore reducing the likelihood of hypothermia. It's also got a role to play in preventing infection from the burn.
More pain relief is needed. For parents Sharon and Jason, it's hard to comprehend how horribly wrong this day has gone.
Oh, it's every parent's worst nightmare. I could not believe how badly he was burnt. It was just horrible.
Guys, what we're going to do is we're going to give him an injection in the leg, okay, which will take control of the pain.
But for a child this small, even administering pain relief is fraught with danger.
So the volume of morphine I'm actually drawing up for Jackson is minuscule. It's actually only 0.12 of a mil. So it's really important that you calculate that properly because you could inadvertently overdose this child in the heat of the situation unless you're clear thinking.
Sorry, mate.
Looking at Sharon and Jason, the parents, they are obviously beside themselves. The fact that this accident has even occurred in the first place is probably eating them up. But it's really important as the treating paramedic that I keep them calm and reassured.
Daddy's here.
It's heartbreaking to hear him scream because I love him more than anything. Kept holding him, trying to reassure him it was all right.
So what have we got? 4-year-old, asthma, short of breath, medical clinic, patient currently on nebulizer.
Across town, paramedics Nicola and Risky are also responding to a paediatric case.
Really hoping he's not really unwell because those jobs are hard.
Oh, absolutely. Thank God I haven't been to a death of a paediatric, but even a sick paediatric these days, having had Mia now, I just have that extra layer of, I don't know, worry as a mother and just your heart, your heart breaks seeing a sick child.
So 15 months ago, I had my first child, which is a little girl called Mia, and I love her to bits. It's the best thing that's happened to me. However, I do have a whole new level of empathy for parents. Watch out, kids.
Silly. Paediatric jobs are hard jobs to do because you're not just dealing with that child, you're also dealing with the parent, and so you almost have two patients. It can make the job way more complicated.
Hello. How are you? Hi. So what's going on, Mum?
Well, he's just had a virus and then, like since yesterday, and then I slept in bed with him all last night because he vomited and I was worried if he was vomit.
I'll take that off him just for now.
And he, just more recently, like this morning, early this morning, he, I just noticed that he was breathing really fast.
Panicked mum Amy rushed her 4-year-old son Luca to a local medical clinic where the doctor immediately called for an ambulance.
We brought him in straight away and put him on nebs, and he's had quite a limited response to treatment.
Now, Luca, do you mind if I listen to your breathing? So I'll warm it up first, okay? Because it might be a bit cold. I like your ears.
With Luca's sister Eloise hovering close by, Risky listens to his chest.
Are you ticklish?
Yes.
The news is not good.
It is still very rattly and...
Still something going on.
Absolutely, yeah. So after assessing Luca, his chest just doesn't sound right and he's still got an increased rest rate. So, you know, this could be anything, but this could even be the first signs of asthma. We'll get him to the right place and then they'll take care of him, okay?
If asthma is unmanaged, it can have serious consequences. Luca needs to go to hospital for a diagnosis.
We always second-guess ourselves as mums, and I definitely at that point was feeling guilty about it. I should have done something earlier, or I should have taken him straight to hospital, but I didn't want to be that mum that was clogging up the waiting room with something that wasn't urgent.
All right, we'll put your racing car harness on. Amy, she's shattered. She's obviously upset about what's happened, and instantly as a mother, I just want to give her a big hug.
So there's no wheeze, but I reckon it's more chest infection. Yeah, because it sounds like, I don't know if you call it bronchi.
Yeah. Looking after your kids, keeping them safe, it is overwhelming, and when your child's not breathing properly, it's actually very frightening. Hearing the word asthma was quite shocking, and my mind was racing a million miles a minute. It was more serious than what I'd realised.
I'm just going to lower the back of this bed down for you a touch, okay? So just relax back with it.
50 kilometres northwest of Melbourne, Micah paramedic Matt and the air ambulance crew are about to airlift their patient Natalia to a trauma hospital.
Side, ready?
Oh, no.
1, 2, and 3.
Oh.
Breathe with it, it's okay. And back on 3, 1, 2, and 3.
Oh.
Natalia's been in a significant car crash. You know, any vehicle that gets hit by another vehicle at potentially 100 kilometres an hour has the possibility of having significant injuries.
I'm just going to lift your head up slightly.
Yeah.
The 21-year-old hit her head during a high-speed accident on a country road and is suffering from memory loss. She also has severe pain in her abdomen and hips.
Where's that hurting? Your tummy still?
Natalia's partner has already been taken to the local hospital with minor injuries. But despite repeated reassurances, her amnesia is stopping the message getting through.
With Natalia, it's a horrible situation to be in because she's been told what's happened to her boyfriend. Then a minute or two later, her brain has sort of wiped that information that you've just explained to her from her brain. And so now she's asking those same questions again. So all we can do as paramedics in those circumstances is just continue to provide reassurance.
You're going to be okay.
Thank you
so much. All right, so just take some nice big breaths. Just relax, okay?
Because it's one of those things that at a car accident, the people involved in the accident get separated. One goes in one ambulance, one goes in another ambulance, one goes in a helicopter.
Bit of a scary thing to go through.
So you get separated from how your partner or how your friend is actually going, and so you get this element of concern and anxiety that's associated, which can make things much worse for the patient. Tender loving care is the best management that we have. By me sitting down and holding their hand and say, it's going to be okay, we're here to look after you, you can automatically see straight away decrease in patients' respiratory rate, their anxiety levels decrease, and which has an overall effect on their heart rate, their blood pressure. Having a good emotional connection and support to your patient is probably the best management that we can do.
The main thing is your partner is okay and the other person's fine as well. Everybody's come out of it all right.
We can't stop accidents occurring, but what we provide as paramedics is emotional support and care through probably one of the most traumatic experiences of these people's lives.
So as we start to get near the helipad at the hospital, the helicopter does a little bit of shaking, which is a normal thing, so it just seems to vibrate an awful lot. And the pilot we've got is pretty terrible, so it seems to vibrate more than normal. Really? He's got a name called Shonky for a reason.
Just what lasting legacy Natalia will have from the traumatic crash won't be clear until extensive testing has been carried out.
We'll get you down to the hospital and get you seen and sort you out.
We often think of car accidents just being the physical injuries that people sustain, but it's also the emotional and mental impact that those car accidents can have on a patient in their long-term recovery.
Yep, no worries. Just a bit of cool air as you come out, okay? Just nice big breaths. You're going to be okay. That's...
We're going to get him out to the ambulance now.
In a heartbreaking accident, 19-month-old Jackson poured a cup of hot coffee over himself. Now, Micah paramedic Mark needs to get the tiny child to the Royal Children's Hospital for further treatment.
Cases involving serious burns are time critical. Now that we've got dressings and effective pain relief on board, it's imperative that we start transporting Jackson to hospital for specialist care.
I know, mister.
Shattered parents Sharon and Jason are trying to stay strong.
I know, mister. It's okay.
It's very heartbreaking. You just feel helpless as a parent. You just want to take their pain away and you can't.
Hey, Jackson. Hello, mate. You've had a rough afternoon, haven't you? So has Mum. So has Dad. You're doing a really good job there, Sharon.
As a parent of a toddler myself, I know the kids are so inquisitive and they're always pulling at things, but you can't always have eyes in the back of your head. So I actually appreciate how easily an accident like this can happen.
So I've given him a dose of morphine via the muscle, which I reckon will be starting to take effect now. And he's had 3 doses of a similar drug up the nose. I reckon we've got on top of his pain pretty well, actually.
With Jackson's pain relief taking effect, Mark now needs to assess the little boy's airway.
Oh, no, you're right. Okay. It's okay.
Jackson's making these sort of weird, throaty, chesty sounds, and that raises real concern for me that he's in fact inhaled some of the hot coffee. So it's really important that I work out whether he's in fact burnt his airway, because if that's the case, then I know that it can swell really quickly and it can be a real problem for his breathing.
You're all right, stay there, it's all right.
So I actually inspect the mouth with my torch and I can't really see a whole lot. So although I'm reasonably sure that it's not burnt, I can't actually exclude it there until we get to hospital.
Have you been in an ambulance before, Luca? No, first time. It's a bit exciting, isn't it?
Risky and Nicola are preparing to take Luca to hospital. The 4-year-old is struggling to breathe and the paramedics are worried this could be the first signs of asthma.
You're so brave. Hey? Yeah. How does your breathing feel? Is it still hard?
You're terrible. I didn't do anything wrong.
No. Hey, these things come on really quickly, okay? So don't feel terrible at all, okay? You've done exactly the right thing.
Poor Amy, she's still beating herself up over not taking Luca to the hospital earlier, but in these cases, you've got to do what feels best at the time as a parent, and she's taking him to the doctors. You know, what more can you do?
Are you hot or cold? He said cold.
Cold.
Eloise is a wonderful big sister. I have to say she's really caring, nurturing. She really does look out for Luca and they really care about each other a lot.
Bye, Mom and Luca.
Bye, sweetie. Thank you for helping so much.
Bye.
Dad Darren's now arrived to take Eloise to school, so Risky and Nicola can get Luca checked out by specialists at the Austin Hospital.
You just had your birthday, Luca.
I'm 4.
You were 4. Did you have a birthday cake?
Yes.
Yeah, what was it?
I think it was a chocolate one.
Oh, wow. Chocolate's my favourite.
Usually Luca is just a very energetic 4-year-old. He's really cheeky, sort of mischievous personality, and he's very funny.
I bet it was delicious. Yeah.
But then when you see him like that, really made me quite scared and worried.
There'll be no relaxing for Amy until the doctors can tell her just how serious Luca's condition is.
Both of my children are just the absolute most important thing in the world to me, and to see them in distress or unwell like that, it really does break your heart, and you just do anything to make them well again.
All right. You're so brave. Hey? Yeah.
That's the spirit. Good job, mate. Doing well.
19-month-old burns victim Jackson needs urgent assessment at hospital. The little boy pulled down a hot cup of coffee from the kitchen bench at home. Micah paramedic Mark is now trying to distract his mum, Sharon.
And Sharon, have you got other kids?
Yes, he's a twin.
Twin brother, twin sister?
Twin sister.
Twin sister. What's his sister's name?
Alexis.
Alexis, oh, beautiful names. Yeah. We grew up with a twin sister, mate. I grew up with a twin brother who's a paramedic as well.
Oh, really?
Yeah, yep.
Are you identical?
Yeah, we are, yeah. I taught him a few lessons.
Sharon is showing incredible strength to remain so calm in these circumstances. Not all parents would be able to, and understandably so, but it is commendable that Sharon is so calm and in control.
We've arrived at the hospital, mate. It's okay, Daddy's here. Daddy's here.
Jackson will receive the best treatment available, but there's no guarantees he won't be left with lifetime reminders.
Definitely worrying about, is he going to be scarred? Is it going to affect him as he grows? So that's a major concern.
Oh, my boy.
Bada boom, bada boom. That's something you would do.
I don't think so.
It's been a busy week for Nicola and Risky, but they're enjoying an unusually quiet start to their Saturday night on duty in the city centre.
Or you go, bada boom, and then you look at me and go, bada bing.
Long-time workmates, their relationship is all about honesty.
It's bada bing, bada boom. If I was to say it that.
Why does this always have to come back to how incorrect I am? I have a husband at home, but I have a wife at work, and that is Nicola. She doesn't step back in correcting my grammar. I think I have some pretty good sayings. Not sayings, but just Aussie slang, and apparently they're all wrong, according to Nicola.
If I was to say it, I would say it the other way. First it was nip it in the butt, then there was for all intensive purposes, and now we're saying bada boom, bada bing. I don't think it's something that I really say.
Okay.
Check the tapes.
I think I will.
With their conversation firmly nipped in the bud, a call has come in from a member of the public who needs their help.
Fallen down a step, 60-year-old female. Query fractured arm, looks deformed.
Coral, who lives interstate and is visiting her family in Melbourne, has fallen from a tram stop.
This is it, I reckon.
Yeah.
So making use of the empty tracks, the crew pulls up directly alongside.
Hi, how you going? How's this for service? Have you fallen down and put your hand out? Is that
She fell backwards off the platform onto the rails.
Back this way? Did you hit your head? No. And did you black out at all? So the patient has obviously done some pretty major damage to her wrist. It's clearly deformed and she looks like she's in a world of pain.
Before the distressed Coral can be properly treated, Risky and Nicola need to get her into their ambulance. But the 60-year-old is in so much pain, she can barely speak, let alone move.
Just keep that arm nice and still for me. You're doing really well.
Also on the Saturday night shift is Mark and his partner, fellow Micah paramedic, Karina.
32-year-old unconscious lady.
Well, it says sleeping, so I assume she's breathing.
Their first case is an emergency at a bus stop.
Maybe heroin if we're in a bus stop, are we thinking?
It's late in the evening, a young woman asleep on a bus. Initially, you first think, oh, I wonder what's going on here. I hope there's nothing hideously wrong with her. There's obviously a large spectrum of things that can be wrong.
G'day, how you going? Are you the bus driver, are you?
Yes, yes.
Can you just tell us what's going on, please?
She was completely asleep when I pulled in and she was not responding.
Okay.
Bus driver Keith, at the end of the line, is nervous about his unresponsive passenger.
Was she in that position as we see her?
It took her about maybe 5 minutes just to get her like that.
Righto, to respond.
Yeah. My first reaction was a heart attack or a person was bashed and they were unconscious. We don't know. When I saw the ambulance, it was a sign of relief because I realised help was here and they knew what they were doing.
G'day, how you going? What's your name?
Back.
Sorry?
Back.
Rebecca, is it?
Rebecca, you're with Mark and Karina from the ambulance.
So the first thought is always, does she have some sort of past history? Does she have seizures? Does she have, diabetes? Is she having a hypoglycemic episode? Is there something seriously wrong?
You able to sit back in the chair so we can see your face?
Squeeze my hand. Squeeze it really hard.
Focus on your breathing for me. Big breaths, big breaths.
Risky and Nicola are with 60-year-old Coral, who's fallen from a Melbourne tram stop while on a night out with family.
Deep breath, focus on your breathing.
Squeeze my hand.
We give Coral the green whistle because it's the fastest way for us to get pain relief on board in this situation.
Big breaths, keep going.
Coral is in so much pain she can barely speak. Already using the green whistle analgesic, the paramedics will provide something stronger once they move her into the ambulance.
All right, that's resting, okay?
Well done.
All right,
Well done.
big deep breaths. Do 10 for me and then we're going to move, okay? Yep, good job.
Moving her, however, is no easy task.
Getting Coral into the ambulance is proving to be a little bit difficult.
You're doing really well. Yeah, I'm going to get you something stronger, okay?
With any movement, she's quite uncomfortable. And on top of that, she's already fallen over once tonight, so she's a little bit hesitant about that happening again.
Another little step. And then keep...
I missed it before.
Yes.
And just watch your head as you come in, because the roof's a little low.
With Coral safely in the van and son Eamon watching from the sidelines, the priority is now to get her pain under control.
Basically, we're going to try and pop a drip in her arm so we can give her stronger pain relief before we move any further. Yeah.
But as Risky begins administering the pain medication, events take a threatening turn outside with an unwelcome intruder.
Hey, mate, we're busy with someone else.
I hear some commotion outside. I'm thinking, what the hell is going on out there?
Hey, mate, we're busy with someone else.
In the city centre, Risky and Nicola are dealing with Saturday night drama.
We're just busy at the moment, okay?
They're working to make 60-year-old Coral comfortable after a nasty fall. But there's an unwelcome distraction outside.
Coral's wishing he'd go away, and quite frankly, so do I, and it's really distracting when I'm trying to do my job.
The man's behaviour could easily escalate. Nicola needs to defuse the situation quickly.
All right. We're just busy at the moment, okay? For me, I think putting on this uniform certainly brings a level of confidence and assertiveness that I probably don't have really all the time. Jump in, mate. We're just going to go.
See you, mate.
Just want to get away from that idiot. Yep. You have to have that assertiveness to be able to do the job.
But just, yeah, nice and slow, sick, thanks.
When I wear the uniform, I've got no problem with that.
Is this one?
I'm just coming through here.
With Coral's pain relief being managed, All Risky now needs to do is apply a splint to her arm.
We're probably going to have to cut that off.
No. It's only new. It's only new.
So Coral's been a little bit quiet, and that's probably a combination of the green whistle and her pain. However, when I mention about cutting off her jacket, yeah, she then pipes up.
Stretch that as much as you can. You're doing really well. Don't move that other hand yet. No.
So thankfully, inch by inch, we've managed to get the jacket off without damaging it at all. And so now we can focus on splinting Coral and actually get her to hospital as soon as possible. So were you on your way to the train station, were you, to get the train back to Bendigo?
No, just a tram to get ice cream, actually.
Oh, yum.
Yeah, didn't
Bugger.
Didn't kind of go that way.
No.
Poor Coral. Hopefully she doesn't have to stay in hospital too long and she can come back to Melbourne and have a better night out and maybe even get that ice cream she was after. Sorry, Coral, just a couple of bumps as we come out.
Coral will now be taken for scans to find out just how badly she has injured her arm.
First night in the big city and a bit too much action.
Where have you been tonight? You're in Clifton Hill at the moment. Sorry?
Mark and Karina are still cautiously assessing their patient, Rebecca, found unresponsive on a bus at the end of the line.
Rebecca, do you mind if we sit you back so we can have a better look at you, please?
Yeah, that's fine.
But suddenly, she springs to life and is surprisingly happy to chat.
You normally fitting well?
Yeah, hope so.
How much booze have you had tonight?
4
4 pints?
Yeah.
Finally, we do get a response from her, and that's very relieving. She's a POM, she's over here travelling, she's had a fabulous evening, she's talking like there's no tomorrow.
Yeah. Do you have any food with your pints or just...
No, just pints. They're very little, no pint size myself, but...
You've got no diabetes or any other history of medical problems? No, that's right.
No, that's right.
It becomes very clear very quickly that we don't need to worry. She goes from being almost unconscious asleep to being very chatty. They must have been 4 very big pints.
I normally don't drink on a Sunday, but it's the Queen's birthday. She's my grandma, so I do really not to.
The Queen's your grandma?
Yeah, I know.
So clinically, medically, Rebecca's very stable, but my best description of her would be sublimely relaxed.
Ridiculous, sorry.
You haven't used heroin at all?
No, oh God, no. All I remember is having one too many beers, getting on the bus, and I had a dream that I was giving CPR to a fish. And every time I gave the fish CPR, I could taste the fish. And I was blowing into it, and it was going into a puffer fish. And then I was giving it the whole like chest pumping thing. And I realised, okay, fish don't have lungs, it's not gonna work. And then it like burst into life and swam away, and I was like, that's my good deed done for the day. I'm amazing. It was a great dream.
For all of the seriousness of our job, occasionally you come across a personality that's just great to interact with. And Rebecca is one of those people.
Thank you so much, by the way. Thank you so much. That was really nice of you to check up on me. Come on, give me some loving. Come on. That's very nice of you. Thank you so much.
Oh, no worries. I'm just glad you're okay.
So with Rebecca sorted and ready to head back out on the town,
All these young people out here having fun.
our 2 hard-working paramedics are definitely starting to feel like they may be missing out.
Look at all that wine, Karina.
Why are we not sitting on a deck somewhere eating blue cheese and drinking wine?
Oh.
It's torturous.
It's been 3 weeks since Natalia was involved in a high-impact car crash, which left her in severe pain and with no memory of the traumatic accident. The 21-year-old is still making a slow recovery from neck and back problems, but doctors did clear her of any major internal injuries. Fortunately, her memory has come back, including the reassurance she received from flight paramedic Matt.
So when he told me that, oh, you're actually really good, you're doing really well, and you seem to be healthy, nothing broken, that really calmed me down. But I was still worried about everyone else, so I started crying. So he just wiped my tears off my face, and that made me feel really nice to know that there's people here, they're caring for me, and everything's going to be okay.
A night out on the town ended badly for Coral. Diagnosed with a dislocated elbow and badly fractured wrist after her tumble off a tram stop, the 60-year-old needed surgery. She was finally able to go home after a week in hospital. 4-year-old Luca was taken to emergency after a cold turned into serious breathing problems. After being kept in for observation, it wasn't long before he was back to his usual energetic self. But doctors did confirm that Luca had suffered his first asthma attack. Mum Amy is now prepared with a medical plan.
What about that one? That's a good one. Does that work? It did give me reassurance to know that I would have the medication at home if it happens again. I think I've gotten over my mummy guilt and just happy to have a healthy little boy back. He's sleeping.
And it's been 5 weeks since Mark was called out to rescue 19-month-old Jackson. The toddler had pulled a cup of hot coffee over himself, causing severe burns. Today, Mark's about to find out what sort of recovery Jackson has been able to make.
Hi, Sharon.
Hi, Mark. How are you?
Good. How are you?
Good, thanks.
Nice to see you again.
Good. Come in.
Thank you. Where's the brave little man?
Yeah, he's just through here. Come through.
Hello.
I'm gonna eat you.
Hard to believe this happy little boy suffered burns to his face, arm, chest and airway, and spent 3 days in an induced coma.
Hey, kids. A couple of teddies for you from the ambulance. How you going, Jackson? How you feeling, mate?
Say hi.
He looks well, doesn't he?
Yeah, he does. He's back to his happy normal self.
Where he's had the skin graft is still healing, but the doctors are very happy with the way it's going, so he's just bounced back. He's a happy little boy. You really wouldn't know what he's been through by looking at him.
You being calm really helped us to be calm because you're in control of the situation, and we were just relieved that once you were there, we knew that he was in safe hands.
You guys just did so well as parents on that afternoon. It was a credit to you guys as well.
Thanks,
yeah,
Mark.
that's true.
I'm very thankful to Mark for what he's done for our family to help us in our time of need.
He's a lucky boy, aren't you, mate?
I've been dispatched to an interesting case. It's actually a male that's had his hand caught in some sort of machinery. So the potential for major isolated trauma is very high with this case.
Mobile intensive care paramedic Mark is responding to an horrific accident in Melbourne's southeast.
We're heading right into the guts of factory land here. Anytime we dispatch to a case involving someone who's got their limb caught in machinery, you're obviously really concerned about how horrendous the injuries might be. You're immediately thinking that this is potentially a case where someone may in fact lose their arm.
It's okay. You've got your green whistle if you need it.
Bring on the whistle, man.
As Mark arrives, his patient, 18-year-old Corey, is being loaded into an ambulance.
I'll get some monitoring set up. I'll get you set up for an IV.
Yeah.
All right. Corey, how you going, mate? Mark is my name. Right. You're in a lot of pain, are you, mate?
Yes.
Okay.
Please help me. I'm gonna die.
You're not going to die, mate, okay? Sure. Buddy, we're going to take good care of you, all right? I just want you to concentrate on relaxing. We'll do the rest, okay?
Yeah, mate.
When I first lay eyes on Corey, he's not in a good way at all. I can see that he's pale, he's really distressed, he's in an enormous amount of pain, and I think he realises, even in those first early minutes, how serious his arm injury is.
Please help me.
Do you take any regular medication?
No, mate.
Okay. And are you allergic to anything?
No, but don't put needles in me, please.
We're going to get this drip in. We're going to get you nice and comfortable.
I know, I don't do good with needles, mate.
Corey,
No.
have a listen to me, mate, okay? You've got a really, really nasty arm injury here, okay? You are going to get a needle at some point in your care.
Okay, just do it. Hurry up, please.
Yeah, okay. Just give us a couple of minutes, mate. We'll look after you, okay?
So my first priority in managing Corey is to establish IV access to be able to give him fentanyl, which is a really potent painkiller.
It will be a tiny scratch comparatively, mate. All right?
Underneath that bandage, Corey's probably ripped his arm open, yet ironically, he's worried about a tiny little needle prick.
Okay, mate, here's some pain relief, all right?
Oh.
I haven't done anything. That's the spirit, mate. All over.
With pain relief now administered, Mark needs to assess Corey's wound.
Did you have problems look at your injury? Did it make you feel sick and queasy?
Yeah, mate.
Okay, so I definitely need to have a look at it now, but I'm going to need you to look away. Do you understand?
Corey's wrist and hand are already starting to turn blue, and Mark is apprehensive about just what he's going to find when he takes the bandage off.
Oh, yuck.
Hey, Corey, look at the window, mate, okay?
It feels so late right now.
Isn't it?
I'm tired. I'm ready for coffee and I'm ready for something to eat.
In the northern suburbs, Taz and Amanda are heading back to their base for a meal break when suddenly a motorist gets their attention.
Whoa.
Ooh, do you see that?
Yeah.
Oh,
I don't know what you're doing.
Let's move.
Go.
God.
I don't have my lights and sirens on.
Is he all right?
I think he's not right. Yeah, he's not right.
He's in the middle lane.
He's
too.
dangerous.
So we follow this guy for 600-700 metres, swerving all over the road. I was jaw to the floor for this impending car accident.
It's gonna happen right in front of us. You'll see. Oh, he's gonna crash. He's gonna crash. You'll see.
Oh my God, oh my God, oh my God, oh my God.
He's drug affected. He's drug affected or there's something. He is dangerous.
This sort of reckless driving is all too common. 1 in 4 Victorians who use illegal drugs admit to getting behind the wheel of a car when under the influence.
You're looking at this guy who's driving in a zigzag manner. He'll probably end up either killing himself or he's gonna kill some innocent person on the road.
Oh, look at that.
Oh my God, oh my God, oh my God.
Oh, shit.
Oh my God. It's not our job to pull people over if they're swerving all over the road, but, you know, this guy was going to have a car accident. He was going to hit someone, potentially kill himself or somebody else. We had to pull him over. We had to figure out what was, you know, we had to do something.
Let's try to stop him. Put the beacons on and let's see if we can stop him.
I don't think he'll stop. Pull over. Come on. Pull over.
Yeah.
We flick on the beacons to get his attention and he pulls over to the side of the road. Oh my God.
A second unit has also seen the out-of-control driving and has pulled up for a welfare check.
You okay? It's just you all over the road, mate. You're driving very dangerous.
Have you been drinking?
You missed few cars by inches.
I don't think it's a good idea for you to continue driving. Honestly, like you're going to hurt yourself.
For your safety, I think.
And keep him talking.
While Taz attempts to keep the driver at the scene, Amanda radios police.
RC701, we have a patient who's drug affected in front of us.
Roger, I can create a field of events and get someone heading to the case.
So we've called for police assistance and we do what we can to try and keep him at the scene for as long as we can, while we try and get police to the scene as quickly as we can. Tazzy, just to stall him, just do an assessment.
Yeah. Is it okay if we do your blood pressure and assess you?
Just want to make sure you're all right.
So I suppose you're up.
It is.
Yeah, his blood pressure.
Yeah. It's not going to hurt, I promise. We do an assessment on him. We make sure that his blood pressure's okay. Make sure that there's nothing medically going wrong with this guy.
Your heart is racing very fast.
Oh, yeah, blood pressure's high too.
That indicates that you're under some sort of stress or some sort of influence. You sure you haven't taken any alcohol or anything? The only thing we're concerned is just your safety, mate. That's it. You know, it's your choice, your life. Yeah, only for your safety. That's it.
Eyes are glassy. I think he's on marijuana.
Take some rest, relax, and when you feel okay, then go.
But the driver is not interested in the advice.
All right, well, we can't stop you as long as you drive carefully, mate, you know. And if you're not feeling 100%, please don't drive.
Swerving all over the road.
Is he?
He's still swerving all over the road.
Police backup is only seconds away, but it's too late.
RC701, I see you've attached 56 to this. We were unable to keep the patient at scene. He's driven off.
We don't have the right to detain anybody on the side of the road, and we've cleared him medically. So he drives off and there's nothing that we can do about it.
A frustrated Taz and Amanda head back to branch.
That was a close call.
Oh, numerous close calls that was.
That was a close call.
It's so dangerous. People don't realise how dangerous it is.
A car is a lethal weapon, and we've just had to let him go. Super frustrating, but at that point, I was just hoping that he didn't cause some serious damage to somebody.
I definitely need to have a look at it now, but I'm going to need you to look away. Do you understand?
Oh, yuck.
Hey, Corey, look at the window, mate, OK?
Intensive care paramedic Mark is about to find out just how serious 18-year-old Corey's injury is.
Bear with us, fella. Bear with us.
Doing really well, mate.
His arm was ripped open when it got caught in machinery at his factory job.
This is a really graphic wound. There's actually a large segment of tissue missing, and I can see all the way down to the bone.
Bear with us.
Doing really well, mate.
Good boy. Well done, mate.
I can't move my fingers, mate.
Can't move them, can't feel them? Both, yeah.
The fact that Corey's arm is already turning blue suggests that he's got serious damage to the blood supply to his hand. If this limb isn't actually receiving sufficient blood supply, it will begin to die.
How long you worked here for?
This is my third day.
Your third day?
Just trying to make money for the kids.
You got kids, have you, mate?
Yeah.
How many?
3.
3 kids?
We're going to feed my kids.
Corey tells me that it's his third day on the job and he's out there making $1 for his family. It's so unfortunate that this has happened, and I feel really sorry for him.
So all the way into hospital, I'm going to be asking about your pain level. So we're going to assume it's a 10 at the moment?
Yeah, it's worse than a 10, mate.
Worse than a 10.
Straight to the Alfred, please, guys.
It's probably where we're heading, OK?
Yeah.
You'll be OK, buddy, all right? I'm right to go, mate. Yeah, thanks. Yeah.
Corey is now being taken to the Alfred, one of Melbourne's leading trauma hospitals.
The earlier that he can have surgery, the better the likelihood is that he'll keep his arm.
You're a big boy, mate. Keep fit.
Running after the kids, bro. That's what happens, eh?
Running after kids. Yeah, I got one of my own, another one on the way.
Boy or girl?
I've got Jack, he's just turned 2, and the other one we're not sure of yet. It's a bit early, so...
I wouldn't find out, mate. It's the best thing ever.
The surprise?
Yeah.
Yes? I'll have to run that past the missus.
The young father of 3 is in danger of losing his arm after it got caught in a factory conveyor belt.
This is one of the worst injuries I've ever seen, and it's really important that I engage him in conversation about things other than what's happened tonight. He's having the worst time of his life, and I really don't want him to be solely focusing on the nature of his injury.
My kids love the ambulance.
Do they? My little boy, all he goes is beep, 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 wee-wah, wee-wah. That's all he does.
While Mark has now been able to calm Corey down, the veteran paramedic is very aware of the ramifications of this horrific injury.
So you're going to be a bit of a celebrity when we get into the Alfred Hospital, mate, because I've told them about your injury. There's going to be some very important people there to have a look at you pretty early on in the piece, OK? Which is good news for you, because you need specialist help for this, OK?
I'm going to lose my arm.
I have taken some very, very serious injuries to this hospital and have been seriously impressed with what they've done with them, OK? So you're in the best possible hands tonight.
So Corey's asking me if he's going to lose his arm, and honestly, based on the assessment of his injuries, I can't exclude that that's not going to happen.
Even if doctors can save Corey's arm, he will still face multiple surgeries and an extended rehabilitation.
I really hope that he's able to return to work and provide for his family, but I'm really not sure.
You're gone, buddy. Oh, hello.
What are you doing?
I'm on J-Swipe.
It's an unusually slow start to a new shift for Leonard and Nat. The busy single mum is using the rare downtime to her advantage.
What is J-Swipe?
Jewish Tinder.
Jewish Tinder.
Jewish Tinder. I kid you not. I need a nice Jewish boy to take home.
Give me a look.
What do you think? Dating is very different nowadays to what it was 20 years ago. It's all online. Show me how the fire truck works. That's an ambulance, did you know?
With her workload as a paramedic, plus looking after 3 kids, Bella, Jake and Olivia, it doesn't leave a lot of time for finding love.
My family are everything to me. Coming home to my kids and seeing their smiling faces and hugging them and kissing them, it reminds me why I do what I do.
My favourite fruit is definitely apple. Sometimes when I haven't seen her in a long time, I miss her, but I understand that she's saving people's lives, so that's good. Boom, boom.
When I'm with them, I make sure that I give them 100% of myself, the same way that I do when I'm at work with my patients. Is my heart working? What sound does it make? Look, it's hard to find time to date. Boom. Can you check it one more time? But hopefully I will meet that special man soon.
Today, Nat's search for true love will have to wait. The team are on their way to a 2-car collision.
We've got one female with a laceration to her forehead, and at the moment that's all the information we have.
Okay. Always going to get a car crash today with the slippery weather.
And the rain.
And the rain, of course.
It's going to ruin your hairstyle.
Yours going to get all frizzy.
Indeed it will. And it looks like they're giving you...
Thank you.
Yep, so right at the lights.
Luckily, the paramedics are only moments away from the crash site.
Be a little bit careful here.
Clear, 1, 2, 3. All clear.
Thank you.
Just here up on the left.
There we go.
See? Oh, God. Yep, we've got blood on our face. Let's get her in. You happy with that?
I think so.
Let's just do that.
The crash has left wreckage strewn across the busy road.
Are you okay?
I'm okay.
Okay.
A family was in this silver car.
You're an Uber driver? Yeah, that's goodness me.
The black car is an Uber, which had 1 passenger on board. She appears to have a significant cut to her head.
Let's get you inside where I can have a look at you properly, sweetie. Nowadays, with modern cars, seatbelts, airbags, we don't often come across isolated head injuries, so I'm not quite sure what she's actually struck her head on. Have you been knocked unconscious at all? Have you lost consciousness at all? No. Were you wearing a seatbelt?
No.
No seatbelts? So you were a back passenger and someone was driving, no seatbelt, your head's gone into the headrest?
Yeah.
Okay, never again. Do you understand?
I know.
Okay, because if your head goes through the windscreen...
But I was late this morning.
Sorry, yep. No excuse, okay?
Yeah.
We see people with heads through windscreens, okay? Don't want to see yours. I am dumbfounded. Who today gets into a car and doesn't put their seatbelt on? For me, it's just automatic. I couldn't imagine driving off without making sure that I was safe. Okay, let me clean you up.
While Nat looks after her patient, outside, it's a challenging case for Leonard. He's trying to work out just how many others have been injured in the crash.
I am the one who rang, but I have to go now.
That's okay. If you're not involved in the accident, I'll just make you move out of the way.
It's just chaotic. There are bystanders mixing in with patients, and I don't know what's going on initially.
I think you'll have to be assessed at hospital. I think there's too many unknowns.
I need to take on the role of triage officer, and what that involves is going around to each patient and assigning a category based on how severe their medical condition is.
I'm just going to let my partner know. We're going to have to check you out.
Leonard's initial assessment reveals several other people need a trip to hospital.
Nat, there's at least 5 patients.
Really?
Yeah. So we're going to need backup. We're just going to have to, for the moment, because there's too many people. So I can't treat every single one of them.
Let's get another few resources.
I've got to be on my game because this could be quite serious.
We've got police on scene already. We'll need to have fireys here. We might have to send at least 2 AGPs at the moment, and I'll come back once we sort out how many people require transport.
Tell me exactly what's happened. Listen, I want you to calm down and relax. Got that ambulance certainly organised for you, OK?
At the Melbourne Emergency Communications Centre, thousands of calls for help come in every day.
She's in labour, is she? OK, are you with her now?
With ambulance services under pressure, non-critical cases are diverted to a specialist medical hotline.
OK, ma'am, now the finger's not bleeding anymore. Are you able to get her out to the car and just take her down to the hospital?
She sounds quite safe at the moment, so what we're going to do is put you through to poisons information.
I don't think that she needs an ambulance right now. Kids do this all the time. They love putting Lego bricks up their nose.
But there are hundreds more life-threatening cases requiring urgent attention.
Emergency services. Yes, caller, what's happened there?
There's a car accident.
OK, and what's it hit?
A tree.
OK. Are there any people trapped?
2 people, maybe more.
OK, can you see what injuries they have?
I can't see, I'm not sure. It's a real mess.
I'll take the holding point and go run my 300 Belgrade.
Today, wet weather is making the roads treacherous. There's been a huge crash in the Dandenong Ranges, 35 kilometres east of Melbourne.
Scotty, so do you want me on a water lead there, mate? Yeah, we will, thanks, mate.
With roads choked with peak hour traffic, flight paramedic Matt and an air ambulance team are being mobilised.
I'm one to lead now, mate.
It sounds like this vehicle has lost control. It's done a 360-degree turn, gone up an embankment, and then has come onto its side, smashing into a tree. Reports are that the patients are trapped in the vehicle at the moment, so we're going to go off and see what we can do for them.
Rear wheels 2, 1 touching. Yeah, all good on the ground. Might need the raincoats by the looks of it.
Sometimes we're able to land right next to the scenes or very close to the scene. On this occasion, we actually had to land at a local football oval and then get driven by the police up to where the scene is.
Are they still trapped or? Yeah. OK.
Incredibly, the 2 passengers in the car have managed to crawl out of the vehicle and are already on the way to a local hospital.
How is he?
He's conscious, alert. He was wrapped by his arm and I'm just cutting that last bit to get him out.
Firefighters are now using the jaws of life to free the badly injured driver.
Okay, take it away.
When I look at the impact, you know, he's millimetres away from essentially killing himself from the significant forces in the car accident.
What are we getting the patient onto? We've got a bed set up.
We've got the spine board and we're waiting.
Are they in the process of getting him out now?
Matt's concerned about irreversible damage to the patient if he's moved too quickly.
Have we got access set up in the car? Yeah, no worries.
And something where a vehicle is on the side, the roof has been crushed in, the windscreen's been smashed, so you think a high suspicion of somebody having a spinal injury or a fracture in their spine of some sort. So we need to be very cautious about how much we move those patients as we withdraw them from the vehicle.
Who's that in there with the helmet on?
That's a bystander. So he's got my helmet.
Matt's also worried about the bystander in the vehicle. He was first on the scene and climbed into the car to support the injured driver. The Good Samaritan is now under instructions from the emergency services.
Okay, just stop for 1 tick before he moves.
As the senior paramedic on the scene, Matt needs to take control.
Let's bring the hang on, no, shut up. Just wait 1 moment. Can we bring the stretcher up, please? And we'll put the stretcher underneath there. Sorry, you all right? Yep.
Wet weather has created traffic carnage across the city.
Yeah, if you got pain in your chest, it could be broken ribs. I don't think so.
In the northern suburbs, Leonard thinks he's nearly finished examining all the people involved in a high-impact 2-car crash.
I like the special effects. I like that acting, yeah.
The great thing is that despite the severity of the actual car crash, the majority of the patients are walking around with only minor bumps and bruises.
But suddenly, he discovers one more potential patient.
Do you think the back of the car hit you, sir? Yeah. The back of the car, yeah.
I see this other gentleman standing up and I say to him, "Are you a patient or just a bystander?" And he tells me that he wasn't actually in one of the cars, he actually got hit by one of the cars. And I had to take a double take. I'm thinking, what? How?
You're lucky. And pretty unlucky at the same time.
Later on, when I actually see the footage of the car crash and see Johnny get hit by one of the vehicles, I just thought, wow, you really are such a lucky man. You got to buy a lottery ticket, Johnny.
Without a scratch on him, Johnny is thanking his lucky stars.
I couldn't believe it. That car hit to the wall, hit to my leg. I said, oh, I'm gone. I'm dying. I couldn't believe it. I'm the lucky man. Unlucky, but then I'm lucky man.
I will need to put a collar around your neck. There's always a potential that we've got some sort of neck or spinal injury, and so we just want to take all precautions.
Nat's not-so-lucky patient was a passenger in the back of an Uber. No seatbelt left her with a deep gash on her forehead.
How's that?
Yeah, that's
not too bad. Oh, good, there you go. That's the first person that said the collar's okay.
Happy customer, that's what we like.
It's been a tough lesson, but this patient will soon be on her way to the Austin Hospital after all precautions have been taken.
I'll just do the seatbelts first. If you decide you want some pain relief, you let me know, okay? Okay, I'm good to go. Thanks, Leo.
No worries.
Okay. I must say, I think given what's happened, at the moment, it seems that you've come out well. You seem quite lucky that we've just got a cut on the forehead, and at the moment I can't find any other injuries. Have you got any important functions coming up or anything like that?
No, nothing.
No, nothing at all? You're not getting married next week? No. Okay, good. I know this girl thinks she's having a really bad day and that her injuries are severe, but she's actually lucky that she was able to walk away from this scene with a cut on her forehead.
The young woman will be taken straight to emergency to have the deep wound stitched. Hopefully, there'll be no lasting scars.
She's worried about her modelling career.
The doctors are world class here.
I'll take that into account.
Be careful.
No, we're not. We've got you, I promise. We don't drop anyone.
Who's that in there with a helmet on?
That's a bystander.
Back in the Dandenong Ranges, emergency services are still working to rescue a 48-year-old man who lost control of his car on the wet road and rammed into a tree.
Okay, just stop for one tick before he moves.
Responsible for patient welfare, Micah paramedic Matt is taking charge.
Sometimes we find ourselves in high-stress situations, and so the pleasantries get put to the side, and sometimes we have to be assertive in our response.
Let's bring the hang on, no, shut up. Just wait, one moment. Can we bring the stretcher up, please? And we'll put the stretcher underneath there. Sorry, you all right? Yep.
We need to stop and we need to organise things before we continue on.
Everyone set there? Yep. He can rest back onto the spine board now. Just make sure it doesn't twist. Now, mate, we're going to drag you up the bed slightly, okay? On go. Ready, set, go. Righto. Now, we'll grab the spine board and we'll move the spine board in just a moment, okay? Keep your arms on your chest for me, mate. Arms on your chest. Put them both down on your chest. Arms on your chest. Good man.
We're able to grab hold of the patient and support his head and protect his spine at the same time and bring him onto the spinal board and then move the spinal board onto the stretcher.
Okay, and we'll just move down onto the road so we've got a flat surface to work on. Just mind your back there.
And then it's a process of moving him down onto the road where we can reposition him on the stretcher and give him the care that he needs before we put him inside the ambulance.
So, mate, we're going to roll you on your side towards us, okay? You keep nice and firm. Go. All right, and board out. Straps coming through. Straps through. And clear. Go. What's your name?
Sadiq.
Sadiq? No worries. My name is Matt. Now, let's get in the back of the vehicle. We can start again.
With Sadiq now safely extricated from the wreckage, Matt and the team can start assessing the extent of his injuries.
I get you to come down the top end and just start removing clothes and all that kind of stuff.
Just going to cut some of your clothes off, Sadiq.
Yep.
The patient has got an obvious cut on his head and he's got what appears to be a bit of swelling in his arm as well. So we have to try and work out what's actually gone on.
You had a car accident, okay?
Do you remember it at all or not?
No.
No, okay, no worries. Do you know what day of the week it is today?
When I assess him, he actually isn't able to tell me the right day of the week or the right month.
Do you have any major pain anywhere at all?
I see a little bit here.
A little bit there.
So it sort of indicates he may have had a bit of a knock on his head and is a little bit confused from the incident.
But despite Sadiq's confusion, there is one thing he remembers all too well.
Was my kids all right? Yes. Oh, is it your daughter and son in the car or your wife, was it?
My daughter and son.
Daughter and son. They're okay. They just gone to the local hospital to get checked over, okay? But they're okay.
For the first time, Matt realises the two passengers in the car are Sadiq's son and daughter. Sadiq was about to drop them off at school when tragedy nearly struck.
So we all transport our children around every day, day in, day out. To be involved in a car accident and have the potential to have hurt or injured your children would be extremely distressing for anybody or any parent in that situation.
What's happened?
Car's totaled. Your car's ruined.
I hit tree or...
Tree, yeah. So you've come around the bend, and because the road's so wet, I think you've lost control, okay? And you've done a bit of a 360 and then hit a tree.
Is my kids all right?
Everyone's all right.
Thank you.
Okay? And your family's all right.
Sadiq's lack of memory is worrying paramedics Georgia and Matt. It may signal a significant head injury.
Every 5 minutes or so, that repetitive questioning comes out of him. Has he caused any damage? Has he caused any injury? Was he at fault? How did it happen? All those things keep on flooding back to him.
And do you remember where you were this morning before you left?
No.
No, you don't really remember that?
Can't remember.
When a patient's doing that, I'm assuming that they've had a loss of consciousness, but it can also indicate to us that they've had a bleed inside their brain that can have the potential to deteriorate much further.
Meanwhile, Sadiq's wife has only just heard the shocking news after finishing her train ride to work.
It felt as if everything around me has vanished all of a sudden. Everything has become blank. And I probably don't have a life anymore because what I call my life is my family. And I was saying to Lord that if I have done one good thing in my whole life, then please keep my family safe.
Squeaking in, door for lock, patient secure, and we're all secure in the back now, thanks. Going to be under 10 minutes to the Alfred chat. 10 minutes. Excellent.
The team are now on the way to the Alfred Hospital to have Sadiq's injuries assessed by trauma specialists.
We look at Sadiq and the type of injuries that are obvious to us at this time. And, you know, he's got a cut on his head, he's got a bit of a loss of consciousness, he's got a sore arm, but we don't know how it's going to affect him in the long term.
Landing gear? Low on 50, landing gear's coming down.
He's definitely a very lucky man from this incident. You only need to look at the vehicle and the damage that's caused to it and where he would have been seated in that vehicle to realise how lucky he was. I'm tipping it's 1 foot either way that could have caused severe injury to all of the members in this family, but on this occasion, they all appear to have been very lucky.
Sadiq, we're at the Alfred Hospital. Can you tell me what day of the week it is today?
Friday.
Friday, good man. What year is it at the moment?
By the time the team arrive, Sadiq's conscious state is already beginning to improve.
Good man. Can you remember where I said we are?
Alfred Hospital.
Good man. A little bit of rain as we come out, mate, so you'll get a little bit wet as we get you through there.
Sadiq's wife is rushing to the hospital, clinging to the hope there will be good news.
First, I was praying for his life. Then I was praying for his good health. Then I was saying, even if anything major happens, still please keep him alive.
Have you got pain at the moment?
All the paramedics and nurses, doctors, so passionately they were helping him. You know, you feel supported. You don't feel alone.
Emergency services.
My baby's 4 months old. He's had a cold, but he keeps choking and going through. I've just got him, like, face down and patting him back. I don't know what to do.
How
Just watch him very closely and don't slap him on the back. And if he starts wheezing or becomes unconscious, tell me immediately. I'm going to stay on the line with you, okay?
Today, Amanda and Leonard are on roster together and are just starting a new shift.
It's all right, it's all right, it's all right, it's all right. Don't. Oh my God, people. Just go. Everyone just go.
An emergency call to a 4-month-old baby is putting everyone on edge.
For the most part, paediatrics are possibly the scariest jobs you could ever go to. And for me personally, someone choking is my worst nightmare.
Let's take our oxygen in.
At least our airway stuff, I reckon.
So put the two together and you've got possibly the worst job that you could ever deal with.
At the apartment block, a neighbour leads the paramedics to distressed mum Nadia and her sick baby.
Hello. Who have we got here?
Peter.
Hello, Peter. Do you want to take a seat somewhere wherever comfortable and tell me what's actually happened to little Peter?
He's had a cold.
Yes, yep. For how long?
Started yesterday.
Yep. This morning, what's happened?
He woke up really early, lots of coughing. It's like something stuck in his throat.
Right.
Yeah, and he went really blue. Just, couldn't get it out. And
Because he sounded like he was trying to
get
cough something up.
Yeah.
And was struggling. And then all of a sudden he let go of this big mess here.
I just kind of put him upside down and was rubbing his back. And
Good instincts, that's awesome.
Very good, yeah.
Babies are quite dynamic. They compensate for a really long time, but when they're sick, they go downhill very quickly.
Apart from struggling to breathe or cough and the bluish kind of face, were there any other symptoms? Did he go floppy or limp in any kind of way?
Yeah, he was really floppy and not his smile.
Certainly wasn't moving around, interacting. And even shortly after he actually coughed up all the milk and mucus, he still wasn't right?
You really have to have empathy when it comes to mums because they know their baby better than anybody. And when that child stopped breathing and went blue, I can't imagine the stress and despair that she would have experienced.
How did his breathing sound?
Sounds perfect, and his respirate's rate's around 40.
So his lungs sound good.
Yeah. He doesn't have a temperature, which is great. Yeah.
After checking Peter's temperature and respiratory rate, Leonard and Amanda have good news for stressed out first-time mum Nadia.
He looks really normal. He looks fantastic. Yeah.
Hello.
Obviously, the fact that he was blue for up to or slightly less than a minute and went a bit floppy and it hasn't been very well for about a day is a little bit concerning.
Given Peter's age, Leonard's taking the conservative approach.
Although he looks okay for us, we're not paediatricians.
A trip to hospital is still required.
Hello.
But at least one member of the team seems to have an ulterior motive.
I'm not going to lie, I'm going to ask you for a cuddle.
Amanda might actually steal your baby. Yeah.
You want to go with them for the day?
Yes, please. Hi, Munchkin.
I finally pick up this gorgeous baby and he is so special.
I got some slubber.
And my ovaries are screaming.
We're going to take the stairs nice and slow.
The moment that I see Amanda hold little Peter in her arms, I'm thinking, she is clucky. You have to remember, it's not your baby.
I want it to be so bad.
We're going to have to find if we've got a really fun toy for you.
I'll make a glove.
Oh, wow, you do have a big jelly.
Inside the ambulance, Peter's safely strapped in with a special paediatric harness.
We'll just see how he goes. Hello. He's such a good baby.
Yeah.
Here we go.
Leonard, who's only just proposed to his girlfriend after nearly 10 years together, is also falling under Peter's spell.
Oh, look at that face. Most of the time when I take kids to hospital, they're screaming at me, they're throwing things at me. But I have to admit, little Peter, he's unbelievably cute. He's a 10 out of 10 in terms of the cuteness factor.
Are you happy to head off?
Yeah, look, I'm happy to roll.
A couple of bumps because I'm on the nature strip.
Get a bit bumpy, fella.
He likes the bump.
So he's your first child.
First child.
It's amazing. Yes, you are.
Unfortunately, I was driving, but I probably would have done backflips to swap positions with Leonard because this child was just so fun to be around.
Sure you don't want to have a baby, Amanda, now?
Could get lucky and have a Peter.
Yeah, but I could also be very unlucky and not have a Peter, you know?
A gamble. Boy, don't I? Already here. That was quick, hey? You're going to be smothered by all the nurses.
Oh, they're going to love it.
You might actually be admitted to hospital for a week.
Just for cuddles.
After the all-too-short trip to the Austin hospital, It's time for Amanda and Leonard to say goodbye, reluctantly, to their little patient.
Oh. Look at him, the little chiller. You are so cute. You are so cute and so handsome. You know it too. Look at your face. It's so rare for us to see children who are happy in the back of an ambulance, but this child was happy as Larry. I've never seen someone so comfortable.
He's seriously going to get a lot of attention.
Please help me.
It's been 4 months since Corey's arm was ripped open in a factory accident.
I'm going to need you to look away. Do you understand?
Oh!
The father of 3 did not lose his arm, but suffered major nerve damage and has endured 15 surgeries, with more to come. Doctors have told Corey his best hope is getting back around 35% of normal movement in his arm.
I'm just trying to make money for the kids.
Unable to work, the 18-year-old has been forced to sell his car to pay the bills and look after his family.
Keep your arms on your chest for me, mate.
It's been 3 months since Sadiq lost control of his car and crashed into a tree with his son and daughter on board.
I just saw one car in front of me and then I tried to avoid that car. After that, I can't remember anything.
Miraculously, his children managed to get out of the wreck with minor injuries, but their dad was not so lucky.
Can you come here, please? Food is ready.
Sadiq's left knee and right shoulder were badly damaged, and he still suffers from chronic pain in his neck and back.
You want some?
It'll be weeks before Sadiq can return to his job as a chef. He still has nightmares about the accident.
It's like, for me, it's worst time in my life, yeah. I'm still having lots of bad dreams. Every night I wake up, so I start screaming at night, and sometimes I cry as well. I can't forgive myself if something happened with my kids. Yeah, thanks God. God save us. Happy birthday to you.
Thank you very much.
Today is his wife Irfat's birthday. She is grateful she still has her family to share it with.
I was thinking all these pleasure, all these fun would have died along with this catastrophic thing if things were different on that day.
No, also my daughter made beautiful cake for you last night.
I already ate half of it last night.
She made fantastic cakes.
Life and death are so close. It's just a fine line. Any moment, everything can change. I'm very thankful that my family is back to life and they are doing fine. It's beautiful, like always.
Because there's special love on it. Always extra love.
As for tiny Peter, he was diagnosed with a viral chest infection and spent the day in hospital being monitored before Mum Nadia was allowed to take him home. The 4-month-old is still happy as ever. Turns out that smile may have had a profound impact on a certain paramedic.
Did Peter make me slightly clucky? Maybe a little bit at the time. I can't say I want kids immediately, but you know what? If any kid's going to change my mind about having children, I think it's going to be little Peter.
He was so cute.
One day.
I'd love to see you in 15 years when you've got 5 kids and 2 dogs and like this white picket fence house and you're like, yeah, I love my kids, they're amazing.
My own little creche, my own little childcare centre. Change man.
Exactly.